Natural in my office means that we want the teeth and the health of the mouth to be what nature intended. So we want to have, restorations that look natural and not necessarily like they're made in a lab or, created on a lab bench. We want it to really look like it grew there. We want it to match the rest of the face and the rest of the structure of the head and look like it fits in and look like it grew there. And we want it to match the personality of the patient and what they want and how they want their smile to be, or how they want their mouth to feel and how they want it to feel when they talk. And we also want to use materials that are compatible with the biological body. So we don't want to use materials that conflict or may have properties that detract from overall health, which some dental materials do contain ingredients that are questionable.
Why are there so few natural dentists?
Well, when you go to a physician, you actually have a choice of physicians. You have a choice between an MD that went to a conventional allopathic school or a naturopath that goes to a natural school and they are a physician. It's a 4-year medical degree, and there are chiropractors and osteopaths. There are all kinds of choices of physicians besides MD. However, in the dental world, there's only conventional allopathic dental schools. There are no alternative dental schools. And so all the dentists that come out all get the same curriculum designed by the American Dental Association, and so they all know the same things and practice in very similar ways. And it isn't until dentists start looking kind of outside the box, maybe listening to odd questions their patients might ask, and then say, let me find out about that, and then they start going outside the box and learning about other concepts that they just maybe haven't heard about or incorporated into their practice. And so that's why there are so few, because really not very many dentists go there and learn that.
We asked Dr. Saepoff how she came to be a natural dentist.
Originally, I went to art school and I got a degree in fine arts. And then I went to graduate school in fine arts. And after 1 year of that, I realized, that my childhood dream of becoming a dentist was what I was really going to do. And so I left that and I went to dental school. And the thing is, after being in art school, where I learned to look at things from other points of view as part of my creative process, that's how I learn. That's how, as a human being, that's how I try on new ideas and, learn about new ways of being that help enrich my life and to make me a more, well-rounded person. And so then when I went to dental school, I went in with that, already having that ability and that interest. While I was in dental school, of course, you learn what they tell you to learn and you do what they tell you to do and you graduate. And it was very conventional. I went to Georgetown University in DC, and it was just like every other dental school. And I learned all of the conventional, normal allopathic stuff, including, all the basic sciences, everything. And it wasn't until I got out that, patients began asking me questions. And I said, I didn't just dismiss the question and say, no, that's, nonsense, or that's not how we know it to be. I said, where did you get that question? Why do you have that question? What is it that you read or learned about? Let me read that too, and then we can have a conversation about it, and I'll be able to maybe explain it or, help you understand that better. And that started a long, and very interesting odyssey where I began to look at all of the controversies that are going on within dentistry and see both sides of all of these issues so that I can really serve my patients by finding out what they want and then, helping them get the care that makes sense for them in their life.